many of you know, on Monday, we released data focusing on financial security of Coloradans and how they feel about a number of policy decisions that have been made as a part of the response to coronavirus. And today we are releasing everything. So the full top line results, the crosstabs, the analysis, it's all available at Healthier Colorado's website. We are going to put the link in the chat box here. I know some of you may already have those materials as well. Given how much data we have this morning, we're just going to focus our presentation only on the parts of the survey that are newly available today. I hope that you will have a lot of questions for us today. There are two ways to get answers to those. Throughout the presentation, feel free to type questions in the chat box. We are monitoring the chat box, so we may answer via the chat box, or we'll just bring your question up during the Q&A time. And we will do that at the end of the presentation, have a dedicated question and answer time. During that time, just press the raise your hand button and we will unmute you so that you can ask your questions. If you run into any technical difficulties during the course of the briefing today, please let us know about them in the chat box and we will try to help. Today, you'll be hearing from Jake Williams, Executive Director at Healthier Colorado, David Flaherty, CEO of Magellan Strategies, and Kyle Rojas Legleiter, Senior Director of Policy at the Colorado Health Foundation. And we're going to put the names in the chat box for your convenience. And I think that is it for housekeeping. So I'm going to turn us over to Jake Williams, Executive Director at Healthier Colorado.
Good morning, everybody. Today, Healthier Colorado and the Colorado Health Foundation released the full results of a statewide survey to measure and understand the concerns, needs, experiences, and attitudes of Coloradans on the coronavirus pandemic. This is an unprecedented time for Colorado and the world, and we need to be operating with timely information on what people are experiencing and how their needs and views are evolving. This survey helped us to listen to Coloradans to obtain this critical information. The information this poll has provided sets the stage for Colorado to analyze the statewide and local response to the pandemic and determine the next steps health officials and decision makers can take to support a full Colorado recovery. We understand that some Coloradans faced certain challenges prior to the pandemic that left them worse off than others. This poll provided valuable insights on how we can act to support those individuals both now and over the long term, so no Coloradan has health beyond their reach. We released initial findings earlier this week. These results represent additional key findings and information from that same survey as we continue to analyze these data. Here are the new key findings from the survey. A majority of Coloradans say the stress and worry from the coronavirus outbreak has impacted their mental health negatively. More Coloradans are worried about paying for necessities of daily life, like housing, food, utilities, and prescription drugs. Coloradans also overwhelmingly feel the government should do more to make healthcare more affordable, support individuals who cannot afford food and housing, and provide paid sick and family leave. And most people feel that there are significant changes ahead to the way we live, socialize, and work, even after the coronavirus outbreak is under control. Now I'm going to turn it over to David Flaherty of Magellan Strategies.
Thank you, Jake. Everybody, I'm going to tee up the presentation for today, and I hope everybody can see that all right, and everybody's good to go. And just a little feedback, does everybody can see that front head slide? Okay, yep. We're good? All right. Okay, let's get started. Again, just to reiterate what Jake said, this is some of the other questions that are involved in a 64-question survey, a very extensive 1,000 N sample of Coloradan residents and the adult population. This is not a survey of voters. We also did an oversample of African Americans, so that we have 140 interviews among them, so that we have more statistically reliable results looking at that critical subpopulation that has, without question, at more risk, if you will, from the coronavirus. The overall top line results are 3.1% margin of error, and the African American ones are 8.28. In today's webinar, I want folks to really understand, I'm not going to get into every survey demographic that you can look at each question broken out by, if you will, or get into them extensively, but there's some very unique questions in here. And I want members of the media to understand that rather than the typical race, Hispanic, party affiliation, and marital status in area that you live in, suburban and urban, but also do you live alone or do you live with others, education level, income. Also, are you a caretaker for somebody with a disability or who's a senior citizen? 18%, that's a good observation and sample size. Folks with children in the household, folks with a disability. So I would really encourage, some members of the media look beyond the typical crosstab demographics that you may find. And the data we're going to be releasing today is really going to looking at that. Also, different forms of health coverage, let alone having health coverage and not having health coverage. So again, please look at that. Today's release includes regional data. We have the results by congressional district as well as by some counties. So please keep an eye on that. With further ado, let's get to the other set of questions today. How much have people's lives been disrupted by the outbreak? And basically, 50% of our respondents, or 50% of Coloradans, have said that their lives have been disrupted a lot. Among all respondents, 51% say that their lives have been disrupted a lot, and 35% some. So you're really only talking about a very small percentage of the population currently that say that the coronavirus outbreak has not disrupted their lives. Who's really had their lives disrupted, and just some outliers or population subgroups that are well above what the state measurement averages was. First and foremost, folks that have either lost their job, lost some income, or lost paid hours from a result of the coronavirus, 63% of them. Folks that rent their home, families, folks that have a child in the household, a young adult 18 or younger. But overall, currently, half of our population has really had their lives disrupted, a lot, so please keep in mind on that, and 35% some. Again, I would encourage you to look at further results. Other questions. Today, we're going to talk about and look at descriptions of people's moods, emotions regarding their mental health. There's an open-ended verbatim question that we ask. In your own words, please describe how your mood, emotions, or mental health have been affected by the response to the coronavirus. There's nothing better than just letting the respondent tell their story. And I strongly recommend you read these verbatims regarding their mental health, because it is, there's a lot of nuggets in here, folks, that really can help you understand what people are going through. And just here's a small sample of those responses. I am more stressed out than normal. I have more concerns about my family members' health. Male, 60 to 64, Douglas County. I feel very trapped and alone, Weld County, female, 18, 29 years old. I'm extremely agitated because I am trapped in my house, El Paso County, male, 45 to 49. I am optimistic and nervous at the same time. There are times when you get stressed or worried about the news, but you try to stay calm. It really runs the gambit. Many respondents described being, increased levels of anxiety. Others describe being depressed from isolation. There's a fear of interacting with other people. How long is it going to take for that to go away? That impacts mental health clearly. And some folks are going to be more antisocial whenever we're on the other side of this, because it's just breeding that right now. And many respondents just describe it as being a roller coaster. Sometimes they're feeling up and positive, then feeling very depressed and down. So again, the mental health of Coloradans is very much impacted. And it's important, I think, and I hope you in the media tell that story. And there's just a lot of information today that we're putting that out there. Negative impacts on mental health due to coronavirus stress. And this is more of a quantitative measurement question. So we really had two questions related to mental health that we asked. Do you feel that worry or stress related to the coronavirus has had a negative impact on your mental health or not? Overall, half of Coloradans have said, yes, it has had a negative impact on my mental health. With a little bit of intensity added to that, 19% it's had a major negative impact on my negative health, and 34% a minor negative impact. What population subgroups are really feeling an impact on their negative health? People that don't have health insurance, okay? 69% of them, are 7 out of 10. Younger folks, 18 to 29. And if you were on our Monday briefing, you should be aware, folks, that the younger population, 18 to 29, is also bearing the brunt of economic downturn. They have either lost their jobs, lost income, or lost hours at a much higher percentage than the older population of Colorado. Households with a family or a child, 64%, 2/3, okay? That's moms. And again, that's something that we're seeing time and time again in a lot of these questions. Families are really under the gun here, mentally. They are feeling stressed out without question, whether it has to do with remote learning or lack of remote learning for that matter, putting food on the table. These populations are really feeling the brunt of it. City and County of Denver, 62%, 10 points higher than what we're measuring statewide. And then women, and overall women, and I've seen other national surveys pointing out that women are really bearing the brunt of this. They are more stressed out than men, without question. And our survey reflects and mirrors those findings nationally. It's really something that our stakeholders and our decision makers in our state should recognize. But again, mental impact, half of our population is really feeling the brunt of this. Just to take a little bit more look at this on this next slide, as you can see, men, 46% say yes, it's had a negative impact. And I'm not trying to discount 46% or men being 50-50, but look at them in comparison to women. 6 out of 10 women in our state are definitely feeling it, feeling stress and worry more than men. I'm not saying that men should not be disregarded, but again, that's what the data is obviously telling us. The lower bar graph there, lost job, lost income, or lost paid hours, 2/3 of those folks, is very, very much so. Now, granted, even the folks that are still working, it's 50-50, so we should never discount that. But we feel this is a very solid, strong measurement. Okay, this slide on slide 18 breaks it down by age range, okay? Look at those blue bars on the lower left-hand side, folks. 18 to 29, 69% negative impact. 30 to 34, that young family demographic, 68%, okay, much higher. Now, granted, it's encouraging to see that seniors are not as stressed out, but 1/3 of them still are. But if you ask why, what's that picture that it tells? Well, many of them are either retired, they do not have to worry about putting food on the table because they are retired and their income will continue to come in. These are at least just some of the insights that we think why you see that blue bar go high on the left, among younger folks, and then down as you go towards the older folks. So again, that's an interesting story to tell. But again, let's not discount, seniors are completely fine. There's still a significant percentage of their population is concerned about this and feeling mental health. It's just not as large as younger folks or folks 34 and under, where they are really feeling this impact on their mental health. A second question we asked, how concerned are you about any lasting negative impacts the coronavirus may have on your mental health or someone in your household? Again, just under half, or 46% of our population, say that they are very concerned about the impact, or that 13%, and 33% somewhat concerned, for a combined measurement of roughly half, or 46%. 27% of our respondents said they're not too concerned, and 26% were not concerned at all. The vast majority of those folks, as I just showed you in the prior slide, tend to be older. It's really younger folks, the folks with families, folks that are really, trying to make it and, have a job, if you will. And then finally, it's a double whammy among those respondents that feel the coronavirus that has had a negative impact on their mental health. On that prior slide that I showed you on the prior question, 67% of them are concerned about lasting negative impacts on mental health. So there's a lot of good data in there, folks, to try to quantify and measure that, where it's going. And it's significant, without question. Again, this is going to show some breakouts by gender to the same question. As you can see, among men, 28% say they're somewhat concerned about their mental health, but then look at women. It's 10 points higher at 38%, that green bar. So again, women are really feeling the brunt of this regarding mental health. And again, slide 21, this is breaking it out by age range, and you can see that high green bar among 18 to 29 and so forth. So again, good data to look at this by age. Okay, now let's turn to talk about Coloradans' ability or difficulty in paying for the basic necessities of daily life. And here's what we did. We asked one question before that said, before the coronavirus outbreak started, how difficult was it for you and your family to pay for the basic necessities of daily life, such as food, housing, utilities, and healthcare? And from that question, only 4% said it was very difficult, and 15% somewhat difficult. So you have a combined measurement there of 19% of our population before the virus came along. However, since the outbreak has started, 11%, or the pie chart on the right, that's a 7-point jump, say it's very difficult to pay for daily necessities, and 24%, or 1/4 of our population, saying it is somewhat difficult. That's an increase, if you take the very and somewhat difficult, of 16 points, or 16%. So right now, 1/3 of our population of Coloradans are having a very or somewhat difficult time paying for just the basic necessities. That's, again, a measurement you can clearly see behind the numbers. And another way of looking at this as well, as you see on the left-hand side, half of the respondents said it's not difficult at all for me to pay my bills, 49%. Well, that drops 14 points to where we are today. So 35% saying it is not difficult at all. So even just putting food on the table, paying your rent, those sorts of things, we're seeing a significant move here without question. We did an individual breakup of questions too, asking folks, how worried are you about paying for these necessities of life? And mortgage and rent, healthcare, food, utilities such as power, how very worried or somewhat worried you are. And these are top line responses, folks, meaning this is among all respondents. But when you look at communities of color, when you look at people that have a disability, when you look at some of the populations in our society that are not as economically well off, these numbers are much higher than what you're seeing on the overall. But most importantly, you have a significant measurement of this population and this growth of these basic necessities of a very worried or somewhat worried measurement going higher. Moving on, I just want to make sure that I don't go over my time, folks. Let's talk about the opinion of federal, state, and local governments and their response to the coronavirus. Okay, the survey asked respondents if they thought the response to the coronavirus from the federal government, the state government, and local governments was excellent, good, fair, or poor, as well as local school districts. And really, of those 4 entities, your local school district, the state government, and your local government had very good ratings as, in their response to the coronavirus. Among folks that said, how's your local school district done? 1/4 folks said excellent, and 40% said good. We consider the combination of excellent and good as a solid measurement above 50%. So as you can see, local school district good, Colorado state government doing very well, right behind it, and your local government. So we're in good shape there. But, oh, excuse me, I'm sorry, folks. I jumped ahead there. But the federal government, without question, is not receiving good results at all. Only 12% rated the response from the federal government as excellent, and 25% the response as rating is good. 4 out of 10 respondents rated the federal government's response as poor. This is what we measured. Clearly, what Coloradans are seeing regarding the federal government's response needs to be improved, to say the least, especially because it is, without question, the laggard compared to those other 3 government entities, if you will. Okay, worries about specific needs and programs. And we asked, folks, how worried are you about not having enough money to help folks that are experiencing homelessness and rent assistance? 81%. Essential workers having enough protective equipment in hospitals, masks, those sorts of things. Ventilators, 76%. People extremely concerned and worried about really our safety nets that we have in society and taking care of the most needy in our society. Food programs for the hungry, 76%. Support for mental health and people having the ability to get support for their mental health, 72%. And whether or not their local hospital is going to have enough beds and ventilators. And this percentage shows the respondents that were either very or somewhat worried about these things. And now I'm going to walk through each one of these. It shows some breakouts of by racial groups, if you will, and other subgroups. How worried are you that help will not be available for people who are homeless or struggling to afford their rent or mortgage during the coronavirus outbreak? 41% very worried. Among Hispanic respondents, that number's at 46%. Most importantly, if you look at African American responses, this is a population that's extremely concerned and extremely worried about that. 41% very worried. Very, very high marks. How worried are you that essential workers like doctors, nurses, and grocery store staff will not have enough necessary protective equipment, such as masks to protect themselves while they work? 43% again. But again, look at that percentage among women. Half of the women are very worried about this. Men not as worried, but still split evenly, a plurality of 37 and 37. People are worried about this without question, and it's a concern that would be wise that it's obviously addressed, where people are assured that this is one of their fears. How worried are you that programs meant to support people who are hungry will be unable to meet the needs of Coloradans? 32% very worried, 44% somewhat worried. As you can see, the difference between men and women, men are not as concerned, but they are still concerned in comparison to women. But folks that are on the lower end of the economic scale, less than 30,000 household or less on that lower half, they're extremely worried about this. And those are the folks that are more likely to need access, to these types of programs and rely on them. How worried are you that the people in Colorado who need help and support for their mental health will be unable to get it during the outbreak? 29% very worried, and 43% somewhat worried. And again, as you can see, a lot of the concern is, if you look at the blue bars from 44 and younger on this age break graph, you can see that it's the younger population that really is concerned about this. I'm not saying the older population of our state is not, but they're just not as concerned, but still all significant numbers across the board. How worried are you that local hospitals will run out of the necessary equipment like beds or ventilators to treat patients? Again, 23% very worried, 37% somewhat worried. Little difference between Hispanic and non-Hispanic respondents, although Hispanics are 9 points higher than non-Hispanic respondents. But look at the Black and African American response on this. Very worried and somewhat worried. And I would just reiterate throughout this research, our oversample of African Americans clearly is measuring a worry and a concern among African Americans that is statistically well above the state average, as you can see, where this is one example. How worried about beds or ventilators? 23% statewide response, but among Blacks and African Americans, it's 37%. A full 14 points higher. They are aware that they are a very high-risk group to the coronavirus, and they are concerned that if they do unfortunately get this virus, that there will be enough, safety and beds and ventilators to treat them or their family and loved ones. Okay, changing topics. We asked folks, will you think our way of life will return to the way it was, how it was before, or will there be significant changes? Sort of a viewpoint looking forward question. And this is what we read to them. Some people have said that after the coronavirus outbreak is under control, the way we live, socialize, and work will return to how it was before the coronavirus outbreak. While other people say that the way we live, socialize, and work will change significantly as a result of our experience, which comes closer to your point of view. Folks, 2/3 of respondents said there's going to be significant changes. They expect changes. Where only 25% think it's going to return how it was. Overall, folks, some of the findings behind this is that the folks that believe there's going to be significant changes are the ones that also are most impacted by the coronavirus, either economically, their mental health. The folks that have really had their worlds rocked, if you will, are contributing that 65%. And that 65% is, without question, a very, very high measurement. It's a lot of our folks, but what does that change look like? Well, is the question, comparing to 28% saying it's going to return how it was. And these are just some subgroup breakouts here. Among men, 60% say there will be significant changes, where 71% of women. As you can see across all income levels, everybody expects significant change. And now I'm going to talk about the views of government doing more for public health after the coronavirus is under control. And what we did here is we asked and read to them, they were read a description of 5 things that the government may consider doing to protect the public health of Coloradans, and then asked if they thought, should they be doing, the government be doing more regarding this one thing? Should it be doing less, or should it keep doing about the same amount? And the number one thing of the 5 things, if you will, that government may consider doing once the virus is under control, making healthcare more affordable. 65% think the government should be doing more to make that a reality. Assistance to Coloradans who can't afford food. 61% say that the government should be doing more. Assistance to Coloradans who are struggling to pay their rent. Again, all of the 5 things tested, folks, at this time, not surprisingly, are above, are 50% or above a majority, and some a significant majority. You know, the bottom line is that I think everybody, it's an undeniable fact. We put this in the summary that government at every level, if you will, has been the only entity that's been able to address not just health concerns that our populations are facing because of the coronavirus, but also economic. And keeping this to really, you know, these safety nets, hey, is there going to be a sea change in general thoughts about government being the right entity and the right solution, and therefore we should perhaps invest in some more government programs, or having a government safety net, for you will, so that we can address these types of, you know, a pandemic in the future, and the other, if you will, things that arise. And we get into more detail on our thoughts behind this during the in reading of this summary, but I will wrap it up there and hand it back over to Jace.
Thanks so much, David. I know we've got some questions that came through the chat. And then if others would like to use the raise your hand function, we can unmute you and then you can ask your question. So let's see, my colleagues Austin and Kyle are sort of at the ready monitoring things. And from my end, I say we start with the chat questions. Kyle, if you want to bring those forward.
All right, so the first question we received in the chat is, are you planning to take a second survey to see how mental health and the concern changes as the pandemic continues? Do you anticipate that isolation fatigue might increase the longer it lasts?
Yeah, that's a great question. And one of the reasons why we asked a number of questions about mental health issues specifically on this survey is that we had been hearing from Coloradans in other ways that there was a lot of concern about the mental health implications of this crisis that we find ourselves in, both for the present moment that people find themselves in, but then also for the longer term as well. And when we looked at other national surveys that have been done since the coronavirus outbreak really hit the United States hard, we saw that as a gap in the existing research of what's been asked nationally in terms of people's experiences, their thoughts and sort of values around mental health and all that. So we asked a number of questions about that in this survey. And for us, that's really just a starting point. I think the results that we heard in this survey are really telling about both the volume of people in Colorado who are experiencing this. The verbatim responses that David read to you are really just the tip of the iceberg. We have over 1,000 of those as well. And they're really heartbreaking stories to hear people in their own words talk about what this moment has meant for them, for their moods, their emotions, their worries, and all that as well. And for us, it's a real call to action to continue to listen to how people are experiencing not just this moment, but sort of the ongoing world that we find ourselves in and its implications for our mental health. At the Colorado Health Foundation, we're planning to do another poll later this summer where we will continue to ask questions about mental health. So we'll have an updated set of data about mental health that will be fielded later this summer as well. But one of the things that we've learned through doing research is that polling and this kind of surveying can be a really rich source of information, but there are also limitations to it. You know, it's limited by the questions that we think to ask. And so there's also other ways of listening to Coloradans through more qualitative research methodologies which are richer in terms of what we hear from people. And we're interested in potentially doing some more qualitative research to understand from people in their own words how they're experiencing this moment that go beyond just the questions that we think to ask, and allow us to get a deeper look into how people are experiencing this. And I believe Healthier Colorado also has some plans on the horizon when it comes to digging deeper into mental health.
Yeah, first I would just say that it's really important to consider the broader context when considering the results of this question. Remember that even before this crisis, Colorado is already typically in the bottom 10 of states when it comes to the challenges that we face on suicide, overdose, addiction, and other indicators of mental health. So if you combine that with the fact that a majority of Coloradans are now reporting additional negative impact on their mental health, this is really alarming. And yes, we are planning a poll in the second half of the year. It remains to be seen exactly how we're going to test opinion. Like so many things with this crisis, our polling plan has been altered and upended. But I think given this alarming result, I think we do have an interest in coming back and finding out more about the mental health needs of Coloradans.
All right. The next question we received was, can you break down the numbers of concern about homeless services versus rent assistance?
Dave, do you want to talk on that, or do you want me to?
Why don't you go ahead, Court?
Yeah, so kind of, we asked this question multiple different ways. We asked it, if you're looking at the top lines, T27, we talked about how worried you are that you will be not able to, or excuse me, that help will not be available for people who are homeless or struggling to pay rent. And that was one of the questions that we kept together. We did ask two questions though, on kind of what the government can do to help people struggling with that, whether that's during the coronavirus outbreak or post the coronavirus outbreak, more importantly. And so we did break that up between assistance to Coloradans who are homeless, and 58% believed that they can do more, the government can do more. And then we also asked assistance to Coloradans who are struggling to pay their rent or mortgage. And again, 59%. So not a lot of difference there, but that's kind of how we split those two up regarding homeless versus pay rent or mortgage. But if we need to go into further detail, feel free to ask us more questions or anything like that.
And that's all I have right now in the chat box. If you guys want to start with folks who've raised their hand.
Thanks, Kyle. It does look like we have hand raised, so I will unmute you. And you should be live.
Hey, David, this is John Franco at The Sun. Question for you. In reading through these results, it's not surprising, at least to me, to see that people are worried, people's mental health is not faring well, people want more help from all levels of government, their lives significantly changed. All this seems to be reflected in all the reporting we've done to date and the general conventional wisdom. Is there anything in this that stood out to you as going against what we already knew?
John, I would say right now, and I would say this too, I am still going through everything. I mean, you know, for us to turn on what we have in about 5 days has been a lot. And as I look for some outliers or surprises, and again, I know I don't mean to beat a drum from Monday, but it's women. It's not just women. You know, I didn't believe, or I didn't, how should I say this? I was not aware that there was such a disparity between men and women on every impact from this coronavirus, both financially on their own mental health, on taking care of their families. Sure, I would agree that it's not surprising to find folks that do not have health care or need more assistance, that access those types of programs or need that assistance and support to you know, address their daily lives. But it's women across the board. They are really bearing the brunt of this. And it's the suburbs in wealthier neighborhoods in Arapahoe County, you know what I mean? And in Douglas. It's not inner city, Denver, Aurora, and Colorado Springs, if you will. And I think that's one of the biggest takeaways at this time that I am seeing regarding regarding the impact of this virus from the focus of this survey. So I would say for right now, John, that's what I'm seeing. But I hope to have more to add to that when I get more time to go through, especially the verbatims, and look at them regionally and within certain subgroups. But that's what I would think. But I would happy to have Kyle or Jace or Jake follow up with other questions or observations that they may have beyond what I think is one of the biggest sort of 30,000 foot views of the data.
Yeah, thank you, David. And I go ahead, Jake. Sorry, I think it's important to look at, as David mentioned, we asked a number of non-standard demographic questions, particularly in the world of political polling on this. And it's important to remember that this is a survey of all people in Colorado, not just voters and all that as well. So we're really just starting to mine through some of the different and unique crosstabs that we have at our fingertips with this survey. And some of those we ask, for a specific reason. Are there patterns in folks who are living alone, so who are potentially isolated in quarantine during the stay-at-home order right now? Do they react and respond differently from folks who are staying at home with other people in their household, other people that they might be a caregiver for example? So it's really interesting to look at where there are differences in that data, but it's also important and interesting to look at where we're seeing non-differences in the data. And I think one of the really common questions that we've been getting from policymakers is around geographic differences across the state of Colorado. So depending on how you slice and dice the state and group people together and all that, for me, one of the really striking things is that by and large, we're not really seeing really substantive differences in responses based off of where in the state of Colorado people live. I think it's sort of a truism in our state that, where you live matters, and the western slope is not like the eastern plains, and the Front Range is different from the rural parts of the state and all that. But we're not really seeing that bear out in the data in a lot of interesting ways. So I think that that's another interesting eye to keep on the data as you look at the crosstabs, is not just like where are the crosstabs different, but where are they the same, and where is that potentially counterintuitive?
I was going to say that I was surprised by the numbers that reflect how much people want the government to help more. We'll see if that endures beyond this crisis. But again, the question was, after the coronavirus is contained, should the government do more on a number of fronts, including making healthcare more affordable, food security, housing support, and other items? And I know it's a subjective judgment, but I was surprised at how high some of those numbers are. And something that we're going to look at over time is whether or not that sentiment endures.
Are there any other questions? Raise your hand or type in the chat box, and we are happy to get some answers here. I'll give it folks just 1 minute before we close up here. Any last questions?
We do. Oh, I'm not sure if we have a hand raised or not.
Okay, I'm not seeing anything else come in. I'll check. Austin, Kyle, are you guys seeing anything else that I'm missing here?
Not at the moment, but I hold just 1 sec. I'm going to throw in mine and Austin's email address. If anybody wants to reach out with additional questions, and you can look for the press release to be coming out here shortly.
Great.
With a lot of this information.
Colorado Health Foundation, Kyle Rojas Legleiter, I'm going to turn it over to you just to close us out.
Great. Well, first of all, I want to say thank you to everybody who joined us for this briefing today. I know that there's probably no such thing as a slow news day these days, and there's lots of different angles from which you can cover the impact of coronavirus on Colorado. So we appreciate you taking the time to join us in hearing from Coloradans themselves and how they're experiencing and interpreting the impact of coronavirus in our state. The missions of both Healthier Colorado and Colorado Health Foundation call on us to lead during a public health crisis. The fallout and repercussions of the outbreak are far-reaching and have yet to be fully understood. We knew that public health officials and decision makers needed to hear from Coloradans to start crafting effective recovery plans. We launched this survey together to advise and prepare Colorado to surmount the many obstacles moving forward and to ensure everyone is able to fully recover, whether that be emotionally, physically, financially, or culturally. For us, here's what the original results tell us. First, mental health will need it to be a significant priority for decision makers and providers. There's no telling how much this will impact people across the state long term, and Colorado needs to be prepared to support them. Second, Coloradans are overwhelmingly concerned for others. They need and expect decision makers to do more to find solutions so people who need assistance with housing, with food, and healthcare do not bear the brunt of the pandemic's fallout. And third, people do not expect that things will go back to normal. Leadership in this moment demands thinking about both the present and the different future that we have the opportunity now to shape going forward in our state. Again, we thank you and appreciate you for joining us on this briefing today. Feel free to reach out to Kyle at Healthier Colorado or Austin at the Colorado Health Foundation if you have any follow-up questions or want a deeper dive into any of the data that we shared today. And again, we appreciate you joining us. Thank you.